Hi, and welcome to the Westchester University Dietetic Internship Preceptor Training for Clinical 2 rotations. This is for the outpatient rotations. Part 4B. Thank you so much for being a preceptor during COVID-19 and during this very interesting year that we're in. Without you as a preceptor, we wouldn't be able to really support and guide our interns into becoming registered dietitian nutritionist. So thank you so much. Clinical 2 outpatient rotations are completed in the spring. And for this year in 2021, it's completed over 8 weeks or 264 hours, which equals about 33 full 8-hour days. Interns can complete it either in the first half of the semester from the mid-January to mid-March timeframe, or the second half of the semester between mid-March to mid-May when we finish and culminate the end of the spring semester in May. There are times where some students can either complete the outpatient clinical 2 rotation all at one site, or they might split it up between 2 or 3 rotations, say between a private practice, a diabetes education center, or maybe even a something else. During clinical 2, the course is run by Dr. Davidson. She's there, right there with the picture in the middle. This is a graduate level course that is completed by the interns 1 hour a week over the course of the 8 weeks of the course. And Dr. Davidson teaches the course, and all the interns meet online together, go over either content or assignments, as well as answer any questions or do presentations. It's a 3-level graduate course that they all take during the same time as they're doing their rotations. My picture is on the right-hand side. That's me, Becky Wojcik. I'm the Dietetic Internship Director. I support more the interns that are in their rotations, helping them to make sure that they're scheduled and have all their background checks and clearances ready before they walk into their rotations, as well as any affiliation agreements that need to be completed. And then I meet with the interns and the preceptor, you as the preceptor, either at midpoint and again at final for those rotations that are over at least 5 to 8 weeks long. If it's a shorter rotation, say the intern has split it up between 2 or 3 places, we'd only meet once during that time for a final rotation. During clinical 2, some of the competencies are completed either in the rotation and evaluated by the preceptor, or they're completed in the rotation, written up as an assignment or project or case study for the course, and then evaluated by the faculty. If you have any questions about how to meet or how the intern should meet the tasks or competencies, you're welcome to reach out to me, Becky, for anything that's done specifically in the rotation. And the intern can reach out specifically to Dr. Davidson, the Westchester U faculty, about any of the project assignments or information that has to do with the course. Here are some examples that you'll find on the competency evaluation checklist. So for example, 2.5 is delegate or assign duties to support personnel as appropriate. So for example, if you have a private practice and maybe you have the intern complete some portion of a note or listen in and kind of do a medical scribe while you're meeting with a client, and then they need to put that forward to, say, your office staff, and then the office staff needs to bill or code appropriately, the intern could assign that duty of billing and coding, for example, to the office staff that you have. Or for example, in 2.6, we have referring clients or other professionals when needed, especially in the community. So for example, if you have any clients that might be in need of WIC or Meals on Wheels or psychological counseling, things like that, the intern should be able to refer clients to other professionals when it's out of their scope of practice. During clinical 2, the nutrition care process, performing the steps of it is really important. You don't have to follow the ADIME note standard that we typically work off of if your practice uses something else, as long as it's really performing a nutrition assessment and including things like identifying a nutrition problem and then monitoring and evaluation strategies and any types of reassessments that need to occur. We also understand that there's many different populations that interns may be exposed to, so we just want to make sure that they are exposed to as many different either disease states or populations or age groups as they possibly can be. So you don't have to check off all of these, but any ones that apply during the time that they're there with you is beneficial. Number 4.4 is using clinical informatics to document nutrition findings. So this would be utilizing any charting documentation that you utilize to document nutrition assessments or any information pertaining to clients or patients. At midpoint and then again at final, you will rate the intern on what they've accomplished. And our rating scale is from a 1 to a 4, 3 meaning that they meet entry-level competence. So for all competencies, they have to get a 3 or better. And 1 would be not meeting, 2 would be partially meeting. So if you have any interns that by final would be in the 1 or 2 category, I would like to be notified ASAP so that we can support the intern, provide resources, have any type of conversation or coaching that needs to occur before the end. Sometimes it's not observable, so some interns would split up their rotation at 2 different places, so half the competencies are done at one place, the other half is done at the other. Or at midpoint, it's often in progress where they haven't completed the competency yet, but if they're working on it. I will, at midpoint, the intern and I will make a scheduled appointment on Zoom, and we work through the evaluation then. And then again, at final time, if you're a new preceptor, I can always help support what that looks like in terms of giving feedback and providing the evaluation. The major projects that are completed in Clinical 2 that are done for the course and evaluated by the preceptor, but utilize some of the concepts that they learn while they're in the Clinical 2 rotation are journal entries. They take a journal of what they've done during the week and then summarize that and post it weekly to our online learning platform, D2L. They also will need to attend either a professional meeting, a webinar, or some type of seminar. Next, they will have to complete a population-based education activity that is specifically picking a population that they provide, that they create a lesson plan and nutrition education to. We also have them look at the standards of practice and the specialties within the standards of practice in our profession. And they reflect on what that looks like for them as they prepare to become registered dietitians. For those of you that are RDs, the professional development portfolio that we do every 5 years, we have them create a mock 1 of what they would like to accomplish. And then lastly, they would pick one case from someone that they saw or observed that observed in Clinical 2, and then they would create that case presentation and present it to the group. We do ask that nutrition-focused physical exam information is included. If you don't specifically conduct a nutrition-focused physical exam by touching, sometimes just watching or looking or observing the concepts is really important for the intern to include in their case study as well. Some of you might be providing a virtual or hybrid clinical precepting opportunity for our students, and here just are some tips for you. One is to really create an online orientation. So if you use FaceTime or Zoom or Google Classroom or Microsoft Teams, it's helpful to have a video conference with the intern in the beginning to either orient them to you and your face and your voice, or the other members of your team that you work with, or if there's a facility that you're working out of that you think it would be helpful for them to see what that looks like, you can always do that. You also want to make sure that you introduce the student electronically or virtually to your coworkers or anyone that they would be working close with. It's also really helpful to help interns feel comfortable with online platforms or systems that you use. So for example, Zoom or Microsoft Teams or FaceTime, or if you as a clinical to outpatient provider either use an electronic health record or you're doing telehealth with clients, you might want to do a mock run through of what that looks like ahead of time before they use it themselves or observe you using it. One of the most beneficial things for interns that are doing virtual rotations is to check in with them daily. Set up a consistent time in order to meet with them and communicate how you'd like to check in. Is it a phone call? Is it a text message? Is it an email? Is it getting on Zoom or Microsoft Teams? Just to make sure that the intern understands what they're doing and why they're doing it and when they're doing it. And then the next one would be to really set clear expectations. What do you want them to accomplish? What should they be a part of? When do you need them to be on certain meetings or work on certain projects? This is really the time too to assign and delegate anything that you would like them to accomplish to meet the competencies. So for example, if there's a social media marketing plan that you're working on and you want them to do some research or have a piece of that, you could assign them and give them a due date of when that's due. And also the last thing is to really be available for questions. We know that you have a job to do and the interns know that too. So we want to make sure that they're respectful of that, but also be able to ask questions in a welcoming environment if they come up, which of course they do. One of my suggestions would be is if you're someone that is just available anytime, you want to let them know what that looks like. Could they call you? Can they email you? Can they text you? Or if you'd prefer them to wait to a specific time of the day to ask their questions, or if there's someone else that you can delegate certain questions to, that might take the burden off of the time that you need to do your job. So those would be some options for you, but being available for questions because they're going to be learning a lot through, especially the virtual perspective and standpoint. And if it's hybrid, sometimes doing some of these things in person is helpful to then give them what it looks like on the days that they're working from home or not in the clinic or the site during that time. If you do have any questions that come up, please feel free to contact me, Becky Wojcik. We will hopefully see you via Zoom for midpoint and finals. And again, we thank you so very much for being a preceptor for our program.